Some neighborhoods in American cities are up to 12 degrees hotter than other neighborhoods in the same city, and the reason isn't just about climate or geography, it's also rooted in systemic racism. To understand why some neighborhoods are hotter, we have to go back to the 1930s. In the Great Depression, the US government created a program to stabilize the housing market, and the federal agency created was called the Homeowners Loan Corporation, and they produced maps of cities across the country. Maps like this one of Los Angeles were color-coded. Green areas were labeled best, blue were still desirable, yellow were declining, and then red areas were labeled as hazardous. These maps helped guide the Homeowners Loan Corporation in how risky areas were to give out home loans, as well as private investment. The neighborhoods that were marked in red were often places where Black residents, immigrants, and other minority communities lived. This is where we get the term redlining. These underfunded areas were often chosen for industrial development, highways, and concrete, which replaced green spaces with heat-absorbing surfaces and ended up causing severe urban heat island effects. In general, cities are always hotter than rural areas because materials like asphalt and concrete absorb heat during the day and then release it slowly at night. Here's that same map in another format. As you can see, the less desirable or the more risky areas were central Los Angeles, eastern Los Angeles, and then pockets of southern Los Angeles near Long Beach. Western and northern Los Angeles, as you can see on the map, were considered, more desirable or less risky to give home loans to. This is a map of Los Angeles in 2023. It shows the heat vulnerability score of different neighborhoods. The heat vulnerability score is essentially something that identifies populations in areas that are most at risk of illness or death during extreme heat events. In general, as clinicians, we know and understand that extreme heat can lead to heat exhaustion, heat stroke, dehydration, kidney injuries, and can also have severe worsening of chronic disease like heart disease or diabetes. These historically redlined neighborhoods still have residents who are predominantly Black, immigrant, or other minorities. It's been well documented that decades of structural inequities in housing, infrastructure, healthcare access, economic opportunity, and more have left many underserved communities facing a higher overall burden of health risk. But even after adjusting for indicators of social vulnerability, researchers looked at 11 cities in Texas and found that neighborhoods with higher proportions of redlining showed significantly elevated heat-related outpatient visit care as well as inpatient admission rate. Here's a graphic showing temperature differences between the most affluent neighborhoods in each of these cities compared to the most redlined neighborhoods in those same cities. Multiple studies have shown that what makes the most affluent neighborhoods different and cooler is the predominance of much more vegetation such as grass and shady coverage from trees. In some cities, Black residents are about 3 times more likely to go to the emergency room for a heat-related illness, reflecting long-term disparities, access to cooling, and chronic disease risk. When we talk about climate and health, we're not just talking about weather. We're also talking about history, housing policy, how cities were built. Decisions that were made almost a century ago can still shape the environments that people live in today, and that affects their health. Understanding that history matters because it helps cities plan better solutions, like planting trees, expanding green space, and really investing in the communities that were historically left out. Addressing climate and health means addressing the policies that shaped our neighborhoods in the first place. Really understanding how past policies shaped our cities will help us build better and healthier communities today.